So the medical school's at UCLA, is that correct?
Mm-hmm. Yeah.
Okay, great. Graduated from there, residency.
Yeah, I actually did psychiatry residency because mental health is really interesting. I dealt with a little bit of mental health challenges from some depression, a little bit of mood issues. I think it's from the stress, from not eating the best kind of food. And of course, we all have maladaptive beliefs or coping mechanisms. We all can learn how to function more effectively. What I didn't realize was that maybe close to half of my classmates at UCLA are seeing a psychologist or getting on medication. I mean, it's very prevalent, the high stress, high pressure environment. But that's when I realized that something like an antidepressant, right? What I took was Prozac. It's powerful. It took me out of not only the depression, not only the motivation issues, the ability to enjoy life, but also my issue with food, because I had a little bit of some binge eating issues. I think that was my way to calm my anxiety, and that I had struggled for years. And boom, that's gone. So to me, that is really a testament to how just how much suffering we can relieve by understanding some of what's going on in the brain, right? It may not be the final answer. I don't think, just like people were saying, that none of us has a Prozac deficiency. So it's not that our body needs that particular substance. It's because that substance is tailoring, it's targeting certain brain pathways to really get you out of a very, very detrimental pattern. And then you can, once you're out of what I think of as a danger zone, the danger of not living life, the danger of possibly doing yourself harm, once you are out of that danger zone, then you need to do everything that we're teaching patients to do these days, right? Proper nutrition and all the testing. None of these were taught in medical school. Everything we're doing, if you're not a naturopathic doctor, right? If you're a regular medical doctor, we are not taught any of these. We just know how to diagnose disease. So by getting you out of the danger zone, and then now you can optimize everything so that won't happen again. Before I got into integrative medicine, I was still taking Prozac. And I was doing fine, and I was functioning pretty well. I was, doing really well in the hospital, clinics. I was, fully functioning psychiatrist and teaching other residents. But I was still relying on medications. It was only after I got into integrative medicine and stem cell therapy, after addressing the body as a whole, then I gradually was able to get to be on less and less of a dose, and eventually got off the medicine. I think I got off it probably 2 years ago. Right in the midst of COVID, right? When it's not a good time. But hey, I'm doing better and better. So, that's what I'm helping. I want to get patients to. That's the place I want to get them to. Not that we can't utilize modern medicine, Western medicine, but we use that as a tool. Is not the end tool, because we need to figure out why you got depressed or anxious or sick in the first place. And then we use the tools that we have to address those root causes. And then we can get you off those medications that was for really emergency uses. Yeah,
I love that view. That's such a powerful story to bring us up to where you are today. And I thank you for your candor and sharing what, some of these personal things that really brought you to where you are today.
I think it's going to help a lot of people. I want people to realize that they're not alone, and you don't have to feel bad. When I first talked to the psychiatrist as a medical student, when he asked me all these questions, and he said, "Oh, clearly you have major depression." I said, "Are you sure? Are you sure I'm not just a weak person?" He was like, "Joy, if you think that you can control your depression, then you're very mistaken. It's like having a kidney stone. It's very physical. There's physical basis to it. If you think you can just will your kidney stones away, then good luck. This is no different." So that really helped me to take the stigma out of it. Just think of it as a brain disease. This is a brain disease that we're trying to help.
100%. I love that. It sounds like that psychiatrist, that was probably a real pivotal moment for you to understand both yourself and reframe this entire picture. And that word you use, stigma, both of us being products of the American medical system, we're taught to be martyrs, right? Just work harder, just do more work. And if you can't do that, there must be something wrong with you. And we start believing that. So